Hello everybody, Dr. Randy Wurts in Thrive Chiropractic. Hey, today I want to talk to you about kids in chiropractic. Now, usually when I tell people that I'm a chiropractor and I take care of kids, they kind of give me a strange look, and it's like, kids, do they have bad backs or do they have bad necks? And really the truth answer is, yeah, they can. And it can even start when they're in the womb. It starts when the baby's not able to move correctly in the womb, or bad positioning when they're born, and then when they are born, they maybe some issues or complications with birth too, where they're pulling on the head or moving the head a little bit, and nothing intentional. It's just that's what has to be done for the baby to be delivered. Even C-sections, they'll actually grab the baby by the head and pull, so those can be a situation that causes injuries as well. Now, again, not intentional, but it does happen. So, the first thing that moms will ask is it safe? And absolutely, I can say it's safe. In fact, it's so easy to take care of kids compared to adults. And the pressure that we put on kids is about as much as you would test squeeze for a tomato. Not much at all, just to check and see if it's right. And that's it. You know, not much pressure. And it might be a little bit of like a pulse, just not much, just enough to stimulate the bone, and we can start to feel that the bone is moving better, and that helps us much more. So other things that people will ask me, well, you know, why would anybody come see a chiropractor? Well, first let me explain really how chiropractic works, because you know the kids aren't going to come in and say I have neck pain. Some of them do. You know, a 3-year-old that had neck pain, there were some issues, but babies don't. And 2-year-olds, you know, you don't think of them having low back pain, but they come in as a result of problems with their low back. So as a chiropractor, I'm interested in any damages done to the spine. But you have to realize that the spine is there to protect the nerves. And the function of the nerves are actually to carry messages from the brain to the body and from the body to the brain. So you see, if these nerves have a damage to them as a result of damage to the spine, well, these nerves aren't going to function the way they're supposed to, and they start to have a different effect. We've had this before, where you hit your elbow and you feel it hanging down in your hand. Well, it sends a zinger down in your hand. Well, you know that the problem was in the elbow, not in the hand. So you'll notice that when you've had this before, a lot of people have hit their funny bone. So a lot of times people will come in and they'll bring their children in for different conditions. And you know, usually what I hear, unfortunately, is that I really wish I was in here sooner, or I didn't even know that chiropractic can help with XYZ. And some of those XYZ things are colic. You know, I can tell when moms come in they have a baby with colic, because they are just wiped out. And so baby's crying all afternoon and usually all night, and just can't get any peace as well. Digestion issues. I see babies that spit up a lot, and they're just chronically spitting up, or reflux. And these kids can respond very well to chiropractic care, but they respond better before they're given the Xanax, because if you give them Xanax, they get kind of hooked on this, and your body they fluctuate, so it's kind of, your body compensates, and it'll start to make more. So I noticed that when kids come to me and they're not on Xanax yet, they respond a lot better to the spitting up or other things, other digestion things. They're constipated. So these kids come in, they're bound up, they can't hardly go to the bathroom, and that's another issue too. Now, another one is immune system. So these kids are chronically sick. And it might be that their immune system is really, really strong, and they're reacting to everything, such as like asthma or allergies. It's hypersensitive, or it's not reacting to a lot of things. So they get chronic ear infections or chronic bronchitis all the time. It seems like as soon as they get well, they're back on antibiotics again. And bouts of, not uncommon for me to see a child that has these conditions, like been on antibiotics 10 times before her 3rd birthday. And you know, they're just chronically sick. And mom finally asks, why are these kids getting so sick? Well, we start looking at the nerves. We start seeing behavior turn around too. So the kids aren't so grumpy, and they don't throw fits, and it's hard for them to understand and really process the world. But once you start getting them adjusted, hey, you know what? Their nerves are working better, their body's adapting better to the outside environment, and they can process things and relationships so much better too. Along with sleep, because when the nerves are hyped up, it's hard for the body to calm down for these children, and sleep's another big thing too. Hey, there's a menagerie of things that I've seen kids for throughout my career as a chiropractor. But I tell you, just when I think I've seen it all, usually some kids come in with different things. Inability not to grow for one, ear infections, allergies. The one kid that I had seen, he was 10 years old, he couldn't stand up or he'd pass out. So we've seen those types of children in my experience as well. Failure to thrive would be another one too. So hey, but if you have a child and you're just kind of just like, hey, you've been down this route and nothing seems to work and you're at your wits end, trying to look at something different. As a chiropractor, I'm going to look at the body a little bit different than what a medical doctor does. Ask the question, why does the child have it? Not what symptoms can we just get rid of and let's settle down from there. So if you have any questions about it, please let me know. And if you have a group or an organization that say, like a MOPS organization or a mom's organization that, hey, this might sound something interesting that we might want to talk about, by all means, I'm here as a guest speaker too. I always love presenting in front of groups, especially women, because they're lively and they're fun to talk to. Not that guys aren't bad, it's just women that you really get interactive and you ask great questions as well. Hey, want you to have a wonderful day. Let me know how I can help you in any way. Take care. Bye.